My name's Haley.
I'm Emma.
And I'm Grace.
And today we're going to be talking about a cultural case study. So our patient is Samir Kamal. Is a 10-year-old South Sudanese male child. So this patient lives with his mother and siblings in an apartment complex. His mom has 5 children at home. He has a history of environmental allergies and asthma. The school nurse is meeting with his mother Nadia, and Samir came to the nurse's office after gym with dyspnea. He said, "I normally use my inhaler, but I lost it." His mom asked where did he last have it, and said he often forgets it, leaves it laying around. She says he needs to take better care of that. It's important to have, and it's expensive to replace. The school nurse asks about Samir's behavior at home and mentions his teacher has been concerned about his academic performance and his behavior in the classroom. With the nurse, Nadia doesn't want to discuss Samir's academic performance and behaviors, and she quickly changes the subject. So the first thing we looked at was cultural considerations that we should keep in mind when working with Nadia and Samir. So they're from South Sudan, so there's some cultural considerations. So it's important to know that the culture believes in community over the individual. The nurse should know this to assess what community supports that Samir and his mother have. In the culture, they also have a respect for older adults and professionals, and education is strongly valued. So if Samir is having some difficulties at school, this could be extra concerning culturally for them since education is very important. 47% of immigrants report being proficient in English on arrival. So you would need to evaluate the need for a translator depending if they're proficient in English or not. Keep in mind religious and spiritual needs and making sure to ask about those. And it's also important to remember that people from South Sudanese don't identify with Black American culture, so we shouldn't assume this. And there are multiple different dialects, each with their own distinct differences in the area. So we should just never assume. So our priority concerns for Samir, the number one is the dyspnea, because he has the environmental allergies and asthma, and he lost his inhaler. So the first thing we're going to do is make sure that he can breathe and that is solved. And then once he's stable there, we can look into the behavioral issues that he's been having at home and school. Since he's showing some signs of ADHD, and see how we can support there. His mother mentioned that the inhalers are expensive, so we might want to assess socioeconomic status, provide resources that could help them there, and just remembering Nadia's concerns about discussing Samir's behaviors, being culturally sensitive to that, and figuring out a way to make her feel comfortable.
As the nurse, the assessments that we specifically want to do would be a cultural assessment, which includes the patient's communication style, the needs, personal space needs, degree of acculturation, and patterns of cultural behavior, their concept of time, ability to control the environment. So for this specific culture, they believe that community is more important than the individual. Ethnicity and culture are sources of pride. Respect for older adults and professionals is valued. Education is strongly valued. They are hard workers and often hold multiple jobs. With all of this in mind, we are assessing Samir. While we are assessing Samir, our first priority is to assess his shortness of breath, looking at his respiratory rate, work of breathing, lung sounds, oxygen saturation. And then once that is all at baseline, we can ask him about his triggers with his asthma and how he is currently breathing. So we want to understand what led to this event and possible triggers that we can avoid in the future. We also want to mention that Samir often forgets about his inhaler, and he is struggling to remember other tasks at home or at school. His sister Nadia mentions that he is often forgetful, and we want to explain to her that if we can get more information on what exactly he's struggling with, we can help him. So we want to evaluate his attention, organization, and behavior at home and at school. We want to know he frequently loses important items like his inhaler and is showing a decline in academic performance. This is consistent with ADHD, so assessing whether he's getting adequate sleep, has any trauma-related stress, any language or cultural adjustment issues in the classroom. We also want to avoid labeling him with ADHD initially because in his culture, this is a stigma. Moving on to suggestions we have for change in treatment. We want to address the asthma first. If he is not able to locate his inhaler, we want to give him and his family information on patient assistant programs to help him lower the cost of his inhaler. If we are able to have 2 inhalers, I would suggest having a school inhaler that is to be kept in the nurse's office so we can reduce the risk of him misplacing it in the future. We can also create a plan and a place that Samir keeps his inhaler at home, so when he is experiencing an exasperation, he knows exactly where to go to find it. We want to make sure Samir is using his inhaler correctly, so having him use the teach-back method would be important. And we want to suggest family-centered education and provide information on ADHD, explain that some of the symptoms both Nadia and Samir are expressing might indicate there might be an attention deficit, and if they want to learn more, we can suggest setting reminders, creating set routines, and there are even some classroom accommodations we can create. This can all happen without immediately choosing medication.
So after looking at his dyspnea and his shortness of breath and dealing with his asthma, as well as some of his behavioral problems, we can look at other referrals that can be made. We can refer the family to group therapies or Sudanese groups that are family-oriented for families dealing with mental health in children, so Samir and his mother could feel more comfortable discussing things with others going through similar situations. After confirmation and diagnosis of ADHD or a learning behavioral disorder from Samir's primary care physician or a psychiatrist, we could get in touch with social workers that know more about Sudanese culture to help us understand and formulate a plan to educate and work through Samir's behaviors that is best for the needs of the family. We could also refer to the church that they attend for counseling, as many Sudanese are Christian or Muslim, and religious practices and affiliation greatly influence their daily life. Behavioral and occupational therapists can also help with planning and scheduling for Samir at home and school to make life easier for him. The school should also have individualized education programs or things like that where there are accommodations and planning for students who need extra help, special teachers, extra aids if needed, but the main thing is sticking to a schedule, and once we can formulate that, then that will help him. So the plan for Samir and his family is that the nurse should use nursing diagnoses appropriate to the situation. For example, impaired social interaction, ineffective family coping, etc., to make goals for the patient and family and use nursing interventions based off of the nursing diagnosis. The nurse should also assess asthma symptoms and basic life needs like sleep habits, eating habits, learning comprehension, and then use nursing interventions based on the assessed needs. When discussing mental health, use therapeutic communication techniques and open-ended questions to help them talk through their feelings and needs. The nurse should educate on ADHD, if that is indeed the diagnosis, or whatever their learning or behavioral disorder may be, if it needs, so that the behaviors can be known and how to work with whatever behaviors come with it, how to cope, and the learning process that's associated. The nurse should also educate on asthma and how important it is to use your inhaler, what can happen if you have attacks, give further education more than they already know, and the nurse should also further communicate with the school so Samir can be set for success there, using whatever education plan they might have come up with, as well as discussing need for a second inhaler if that is decided. Using the church, school, and the doctors and nurses all together can help. but we want to encourage consistent routines, schedules to help with behavior, school, and asthma. So as the nurse, our first priority would be Samir's shortness of breath and establishing that he is back to baseline. After that, we would look further into his symptoms presenting with ADHD or the learning disorders. Keep his mom comfortable by respecting their culture and helping where we can, as well as educating. And then we would need to reach out to the school and other resources to help plan what happens next. But we want to keep things comfortable for Samir and his mom and make plans to work through Samir's asthma and potential ADHD or behavioral issues. That way they are well managed.